dear professionals and dear friends. So my topic will be on impact of the herpes zoster on patients with the diabetes and its prevention. See, you all know that the diabetes is a very common disease in the world, in general, India in particular, because of the genomic proposition. So a lot of the numbers of the diabetics are entering and adding every minute in India. And of course, diabetes is the very important cause for the CKD. So these two are currently the leading causes of the disability globally and are increasing the cause of the mortality also. So if you see the worldwide deaths in 2017, so the diabetes and CKD are one of the top 10 causes for the death. And if you project in by 2040, these two are increasing in its incidence. The number one will be the ischemic heart disease. So a lot of practice to the cardiologists, especially interventional cardiologists, followed by the stroke and the dementia for the neurologists, and then the pulmonologists are also having are leading with the COPD and lower respiratory tract infections, and finally the diabetes and the CKD. So this also this clearly shows that if you don't concentrate on the diabetes and its management and the vaccination, which is responsible for available for to prevent the long-term complications of diabetes and also to reduce the morbidity and the mortality. So those people who can afford, and definitely we have to advise the vaccination to avoid the premature morbidity and the mortality. If you see the healthcare costs are very high, 1 in 10 persons predicted to have the conditions by 2045. If you see this slide on the first half of on the left side, see that was the projections of the diabetes. See in 2021 there were 7.4 millions, that means 7.4 crores of the Indians are having the diabetes, and their projection in 2045 will be 12.5. If you see the 22 ICMR diab results, so already India is having about 12.8 crores of the diabetes. So that means we are reaching very high figures of the diabetes 2 to 3 decades earlier to their projections. So by 2045, this is the projection value, but actual result is not 2045. By 2022, we achieved 12.5 crores of the diabetics. I think by 2045, we will be having nearly 30 to 35 crores of the diabetics in Indian population. So that means whatever the specialty you are practicing, you should not forget how to manage the diabetes, because nowadays 1 in 4th or 1 in 3rd adult is a diabetic. I think every other alternate individual aged more than 18 years will be a diabetic by 2045 or the 50. And definitely a lot of the money will be involved as far as the cost is concerned, for his consultations, for his investigations, for his treatment of the complications, etc. So we have to avoid all these things by simply diagnosing the diabetes at the right time and prescribing good dietary approach, exercise, meditation, yoga, followed by your different OHS and if needed insulin. So then only you can cut down the cost of the management of these complications. So diabetes and CKD increases the risk of the severe outcomes. So you are all agree with me that these two people will have a lot of the vascular events, they will be having the lot of the infections. So especially infections like pneumonia, tuberculosis, etc. And the pulmonary diseases like COPD, etc. And vascular diseases, both all the major vessels as well as the minor vessels like peripheral arterial disease, coronary artery disease, cerebrovascular diseases, etc. But unfortunately, most of these people are also having the cancers, malignancies. So malignancies is also very common in the diabetic individual when compared to the non-diabetic individual. A lot of the malignancies are very common in the diabetes. So ranging from your carcinoma of breast, endometrial carcinoma, carcinoma of the stomach, carcinoma of the colon, carcinoma of the liver, carcinoma of the pancreas, etc. So common in the diabetic individuals when compared to the non-diabetic individuals. And of course, degenerative diseases, not only the osteoarthritis, nowadays we are also seeing the dementias. So maybe the vascular dementia, Alzheimer's disease, etc. We are getting much more early in a diabetic individuals when compared to the non-diabetic individuals. So coming to the topic proper, herpes zoster in patients with the diabetes. See, association with the diabetes mellitus and the herpes zoster, there were a lot of the studies of the Marqueux, Aldas, Sedatinelli, Lai, etc. They said that incidence of the herpes zoster in the diabetic population is much more when compared to the non-diabetic population. So they have seen the herpes zoster in the society, and then they divide into the two groups, those people with the diabetes, those people without the diabetes. So the incidence is much more in a diabetic individual when compared to the non-diabetic individuals. See, the diabetes is an independent risk factor for the Post-herpetic neuralgia, very, very dreaded complication, very displeasure, and lot of the people will have a poor quality of the life with post-herpetic neuralgia. So that is also following your herpes zoster. So increased healthcare resources usage following the herpes zoster episodes. Herpes zoster is more severe in people with the diabetes when compared to the non-diabetics, very, very severe. And also herpes zoster may worsen the underlying the diabetes. Not only very severe, once the presence of the herpes zoster in a diabetic individual, the sugars also will go up. So they need more OHS, they need more insulin, they more hospitalizations, more stay in the hospital, etc. are needed in those individuals. So this is the see that patients with the diabetes have a higher incidence rate of herpes zoster compared to the healthy subjects. They have divided into the three groups. First two is aged between 51 and 60, and the center one is between age 61 to 70 years, and the third one more than the 70 years of the age group. So that orange, see the all the three groups, so orange is much more than the blue. That means diabetics getting the herpes zoster is much more even at the age of 50 years at any age group. So this clearly shows that all the diabetics, if they can afford, so definitely there is a choice, there is a chance of putting zoster injection like Shingrix in these people to avoid herpes zoster, to avoid not only the herpes zoster, I am much worried about the neuralgias. So what are the impact of the herpes zoster in the diabetes patients? See, the herpes zoster may contribute to a glycemic deterioration of the diabetes and increased hospitalization. See, 24% of the well-controlled patients with the diabetes, their A1C 6.5, less than the 6.5, excellent control, had increased A1C after the herpes zoster infection. So once he got the infected with herpes zoster, so maybe directly affecting the beta cells, maybe increasing the insulin resistance, etc., but their sugars will be going up. See, the diabetes healthcare consumption in the 6 months post herpes zoster episode compared to the 6 months pre herpes zoster episode, all these things will be elevated. Like your hospitalization increased, length of the hospital stay is increased, medications are increased, not only your OHS but also the insulin, etc. Risks of the herpes zoster in the different comorbidities. So we are all talking about the diabetes only, but you all agree with me that no diabetic will not be having any comorbidities. So most of the diabetes, 95% of diabetes will have other comorbidities. What are the other comorbidities? Most important is the cardiovascular diseases, inflammatory bowel disease, either ulcerative colitis or Crohn's disease, CKD, asthmatics, and of course the females, some of the females may have rheumatoid arthritis and the lupus, systemic lupus erythematosus. So if you see the number of the studies include all these things, the relative risk ratio is also much more in a diabetic individual when compared to the other non-diabetic individual. So herpes zoster, not only the diabetes but also other comorbidities also very high. So they also need vaccination even though they are non-diabetics, provided if the fellow is the female with rheumatoid arthritis, the female with SLE, or a male with COPD or the cardiovascular disease or inflammatory bowel disease, they also need vaccination to avoid herpes zoster and herpes zoster neuralgias. See the multiple comorbidities on the herpes zoster. See the diabetes and cardiovascular disease, heart failure, etc. They are very high. If you see the second graph, risk of the herpes zoster appears to increase with the age and multiple comorbidities. If you see the two small lines, the second one is at a higher level, that shows that diabetes and other comorbidities, higher chance of getting the herpes zoster. What about the quality of the life? So we are very much worried about the quality of the life in all our diabetics. Earlier diabetes means only three things: reduce the fasting blood sugar, reduce the postprandial blood sugar, reduce the HbA1c. But now we are in the age of glycemic pentad. So pentad means two more other than these three. So add quality of the life and also the glycemic variability. So the quality of life is very, very important. But the people with herpes zoster will have the walking abilities, disabilities, relations with the others is at a lower level, normal work is paralyzed, mood is always depressive, general activities are reduced, enjoyment of life is very much reduced, and sleep disturbance also will be there. So these definitely plays a major role in the quality of the life. So the people with herpes zoster and post-herpetic neuralgia, so definitely the quality of the life will be impaired. See, herpes zoster and the post-herpetic neuralgia negatively impact the health-related quality of the life. The same thing in a graphic manner. So changes in the quality of closely correlated with the severity of the pain and persisted as long as clinically significant pain contributed. So some of the patients, my patients with diabetes and herpes zoster, they ask only one drug, to kill them. I want to go to the heaven or the hell. This is a much more very, very difficult. I am managing these pains of the herpes zoster, the post-herpetic neuralgia. So that was the severity of the pains we often see in, especially in the post-herpetic neuralgias. Efficacy of this Shingrix in patients with the diabetes mellitus. So the one of the best drugs available are always the vaccines. So vaccines are the best drugs. So here we have the, luckily we have the one Shingrix. So that is the vaccine against your herpes zoster. See, this is an antigen, glycoprotein E, and you have the adjuvant system. So these two should be combined and given to the intramuscularly for all these individuals. See, elicits a specific immune response against the herpes zoster virus and enhances the immune response to the vaccine antigen. So these two has to be combined and given in the deltoid region, one dose, and the second dose will be 1 month after the first dose. See, the adjuvant system 01B enhances the immune responses. So why you should add the adjuvant system? Adjuvant system, if you see the second half, the stronger, broader and immune response, that will be long-term immune response will be elevated. So if you don't give the adjuvant, so definitely non-adjuvant formulas, the immune system is at a lower level. So that is the reason we add the adjuvant system to your globulins. Say they investigated that in 2 large clinical trials. So Zoster in 50 years of the age group and Joe 70 years of the age group. So there are a lot of the studies from the North America, Europe, Asia Pacific. So in very top countries they did a lot of the studies there. So they studied herpes zoster efficacy in persons more than the 50 years and also the more than the 70 years of the age group. They have given the vaccines 0.5 ml intramuscularly at 0 and the 2 months. We have to give the 2 shots, 1 shot today and second shot 2 months later. So what about the people enrolled? Nearly 14,800 were enrolled here. So what were the results? The results that more than 90% efficacy against the shingles in both less than around the 50 years of the age group and also the 70 years of the age group. So around the 50 years of the age group, they had nearly the 97 to 98%, whereas around the 70 years of the age group, 91 to 92%. Shingrix significantly reduced the risk of the post-herpetic neuralgia and also other complications related to the shingles. So not only the post-herpetic neuralgia, you also have the other complications of the herpes zoster like vasculitis or demyelination or dementias. So these are also very common. They also can be reduced significantly with these values. So this against the herpes zoster for people with the medical conditions, not only with the diabetes, they have identified that the people with hypertension, the people with coronary artery disease, people with asthmatics, the people with CKD, without the diabetes also. So the number of the serious adverse effects, deaths, they were similar in the vaccine and the placebo groups for each of the medical conditions. That means this is a very, very safe, and compared to the people with herpes zoster and or without the herpes zoster, the reactions were very, very little. See here. So they are given the vaccination, and after 5 to 6 years of the post vaccination, the extended period also they studied. They say that either the primary endpoints or the secondary endpoints very, very satisfactory. Adverse reactions, the mild to the moderate local adverse reaction, there may be the redness or maybe the light pain, maybe the swelling. So that may be there in few of the individuals, maybe 0.5 to 0.01 to 0.05 patients, but most of the people they don't have any anaphylactic reactions or the major disorders. Safety results are very, very good comparable with other things. It is indicated for the prevention of the herpes zoster and also the post-herpetic neuralgia in adults aged more than the 50 years of the age group. It is not indicated for the prevention of the primary chickenpox. So this is not indicated to against the chickenpox. We have the different vaccine to tackle this chickenpox, but to avoid the herpes zoster and the post-herpetic neuralgia, you can have it. Shingrix is for the IM injection only. It should not be given subcutaneously. Already I told you the dosages. Data supports the co-administration of the following vaccines. What about the other vaccines? So a lot of the people, if the elderly people, so we give influenza vaccine once in a month, once in a year. So we usually give in the month of the August, the September and October, November, the December. So it's available at the cost of 800 to 600 rupees. Everyone should take one influenza vaccination once in a year. And what are the pneumococcal vaccine? So that is also very often we give for most of our people, individuals, we have the PSV 23 and the 33, and now 20 is also available right now. So that should be given once in a lifetime. And Tdap, especially very much useful for the pregnant women. So nowadays the type 2 diabetes is now occurring at the age of 18, 19, 20 years. So when they conceive, so definitely they need a one shot of the Tdap, so that that gives protection against the diphtheria, tetanus and pertussis. So co-administration with these vaccines with herpes zoster, so definitely Shingrix can be combined with all these things. So usually the elderly population admitted in our hospitals, we give one shot of the influenza today, and after 2 or 3 days we give another shot of the pneumococcal vaccine. Now you can also give a shot of the Shingrix, provided if they can afford, or maybe on the after second day or third day of these in vaccinations. So these are very, very useful drugs. So it is currently approved in the 51 countries. So all over the globe they are very much available. Even India we are having the availabilities there. So more than 90% efficacy, 11 years long-term protection, recombinant adjuvanted vaccine, non-live vaccine, approved for uses in the adults aged, and it is well tolerated. Vaccine recommendations, yes, diabetes and other comorbidities you can give it. So all the top associations, so they have given that CDC from the America, STIKO from the Germany, Italian, and also our ADA and also our RSDD, they all agreed to give this vaccine for all the people more than 50 years of age group. These are our Indian associations. Our APA, that is our Association Physicians of India, 2 doses. RSDD, again the 2 doses more than the 50 years of the age group. Even Indian Society of Nephrology, so they have also given 2 to 6 months apart 2 dosages. So this schedule already I told you, if you give one shot in the January and after 2 months means it comes under the March. Suppose you are giving one shot in the March, so give it in the May. You are giving one shot in November, then you can give it in the January. So most frequently reported adverse effects are the pain, myalgia, fatigue, their headache, etc. very rare. So diabetes summary, so there are a lot of the people with the diabetes, and this vaccination is very much useful. I think this is the best slide of my talk. Thank you.